how many times you were in India and how you find the Indian people and this hospitality of India.
Well,
What would you like to suggest?
Very good question, actually. So, medical field is changing.
20 अगस्त 2026 को लखनऊ के इरा यूनिवर्सिटी, अमेरिकन यूनिवर्सिटी ऑफ बारबाडोस और वेस्ट इंडीज यूनिवर्सिटी के बीच शिक्षा, अनुसंधान और नए आविष्कारों को बढ़ावा देने के उद्देश्य से गुरुवार को साझेदारी की नई शुरुआत की गई। तीनों यूनिवर्सिटी के प्रमुखों ने एमओयू साइन किया। इस एमओयू का मकसद तीनों संस्थानों के बीच छात्रों, शिक्षकों और विचारों के आदान प्रदान के साथ साथ शिक्षण एवं शोध के क्षेत्र में संयुक्त रूप से कार्य करना है। इस कार्यक्रम में भारत और कैरेबियाई क्षेत्र के शिक्षाविदों, शोधकर्ताओं तथा स्वास्थ्य विशेषज्ञों ने भाग लिया और स्वास्थ्य सेवाओं तथा स्वास्थ्य व्यवस्था की शिक्षा के क्षेत्र में उभरती चुनौतियों और नए आविष्कारों के बारे में विचार विमर्श किया गया। एक दिवसीय एकेडमिक एक्सचेंज कार्यक्रम का आयोजन इरा यूनिवर्सिटी में हुआ। इस समझौते पर प्रोफेसर आर क्लाइव लैंडिस, प्रो वाइस चांसलर एवं प्रिंसिपल, यूनिवर्सिटी ऑफ द वेस्ट इंडीज बारबाडोस, सुश्री अनीता भट्ट, चीफ एग्जीक्यूटिव ऑफिसर, अमेरिकन यूनिवर्सिटी ऑफ बारबाडोस और प्रोफेसर डॉक्टर अब्बास अली मेहंदी, वाइस चांसलर, इरा यूनिवर्सिटी ने हस्ताक्षर किए। ये समझौता तीनों संस्थानों के बीच एकेडमिक सहयोग को मजबूत करने की दिशा में एक महत्वपूर्ण उपलब्धि है। कार्यक्रम को संबोधित करते हुए इरा यूनिवर्सिटी के वाइस चांसलर प्रोफेसर अब्बास अली मेहंदी ने कहा कि वर्तमान दौर में संस्थानों और विशेषज्ञों का एक साथ आकर काम करना बेहद जरूरी है। उन्होंने कहा कि इस साझेदारी का प्रमुख उद्देश्य गुणवत्तापूर्ण एवं नैतिक विज्ञान को बढ़ावा देना है। देखिए इस कोलैबोरेशन के संबंध में प्रोफेसर क्लाइव लैंडिस और अनीता भट्ट ने बात करते हुए क्या जानकारी दी।
A big, the conference is going on here, and I'm going to talk with Professor Clive Landis. Clive, just tell about yourself and what you're doing and in medical industry, and what is the connection with American Barbados?
sure. So my name is Clive Landis. I'm the Pro Vice Chancellor and Principal of the University of the West Indies Cave Hill campus. That is the campus of the UE in Barbados. So we're in the same country as American University of Barbados, which of course is a medical school, and the parent entity is of course Era University. So we want to collaborate with the American University of Barbados and ERA, and we have signed a tripartite MoU between the three institutions. And these are going to be covering particularly medical education. They're going to be covering research and development, because health and development are intimately intertwined. And, a country that is developing and growing as quickly as India is, it is now undergoing the chronic disease transition, the transition away from more infectious diseases, nutritional, perinatal diseases, towards chronic diseases, so things like diabetes and heart disease and stroke. And so it accompanies development. And the Caribbean has gone through that transition. And we're suffering a very serious health crisis due to the chronic diseases. So the chronic diseases just in 2023 overtook the sort of infectious and nutritional diseases in Uttar Pradesh in 2023. So that is now the new disease. All of those other diseases are coming down, but the chronic diseases are now on the up. So this is something that we can help ERA, which is a wonderful public institution, which is very dedicated to looking after its community and the health of the community. So this is the new reality that it will need to face. And so we feel that it's a wonderful partnership, because our strength is particularly in our research. ERA's strength, remarkable institution, is in its translation of research from the bench to the bedside. So in terms of medical innovation, it is absolutely world class.
So, as you're talking about that, after the 2023, right, there was a chronic disease actually increases a lot. So, what are your plan and what is the plan of this collaboration, that how to control this disease and how you are going to implement the plans?
Okay, well, um, we don't have the answers in Barbados, I can tell you that, because we are grappling with the chronic disease transition and it keeps on growing. And what's happening is it's moving from adults ever more into childhood. So, you know, things like um, diabetes, for example, it used to be called mature onset diabetes, but now you're getting it in children because of the uh, transition, to this new form of malnutrition, which is overnutrition. And of course, it is driven by the consumption of ultra processed foods, which materially have been defined as malnutrition, you know, by the fact that they have less protein, less fiber, less potassium. They have more fat, total fat and unsaturated fat, saturated fats and sugars. It is defined as the new malnutrition. And, if anyone wants to see the authoritative work on that, The Lancet, which is the most respected medical journal in the world, has dedicated an entire issue to the problem of ultra processed foods, which displace our indigenous healthy foods, leading to all of this illness.
Professor, one question is very important, that you are collaborating Era Medical College, West Indies, and everyone. So, what kind of the support will be delivered to the medical students, and how it helps to the medical education? This collaboration I'm talking about.
Okay, well, so first of all, in terms of students, we have different disease profiles that we face. And so when you are developing your skills as a medical student, you need to have good exposures to the conditions that you ultimately will be needed to treat. So, we would not have exposures to some of the infectious diseases, and even some of the in cases like orthopedics, we would not have as many conditions as you would face here. So our students coming from the West Indies would be exposed to that. Your students coming from ERA to the West Indies, they would be exposed to these modern lifestyle diseases in a way that they would never really have been exposed to here. And so this is how they will be equipped to face this transition, which is coming. And so that's in terms of the students. In terms of the research, I think it's a perfect fit. You have the University of the West Indies, which is globally ranked amongst the golden age universities, um, uh, ranked by Times Higher Education, which is the most respected global ranking agency, in the top 100 universities in the world, and in the golden age universities. So we're very strong in terms of our research. That has always been our strength. But we're not as strong as ERA in terms of taking research and applying it, translating it into medical products which will help patients. That is really where ERA is doing a remarkable job. Digital health is really, I think, its apex product. I mean, phenomenal health information system that they have developed here. I think it's the best I've ever seen. And other innovation products which materially help patients with their illnesses. Ally that with the reach that we have through our publications, the global impact that we have from our publications. Whenever we do something together, we will both benefit.
And the last question is that how many times you were in India, and how you find the Indian people and this hospitality of India?
Well, my first time in India, I spent quite a time here. I spent 2 months here um, after I finished my first undergraduate degree. That was in 1990. It was a very different country then. It's so much more developed now. It's wonderful to see the development of India into this global superpower. The Indian people have always been the same, friendly and wonderful food, lovers of cricket. What is there not to like? And I'm also coming back to India in October. I happen to be attending another conference in Nalanda University. So, to me, the frontiers of South-South cooperation, uh, countries in the global South, to me, it's very logical. We can help each other. I'm very convinced by that.
Okay, we are in Era Hospital right now. A conference is going on here, and we have with us right now Miss Anita Bhatt. I'm going to talk her. Anita, from where you are, what you're doing here in India in Era Hospital.
My name is Anita Bhatt, and I'm the CEO of American University of Barbados. American University Barbados is a 14 years old university in Barbados, which is a subsidiary of Eras Lucknow Medical School. And our directors are Mr. Mohsin Ali Khan, Mr. Misam Ali Khan, and Dr. Farzana Mehdi. Um, so we are here today to bring three universities to work together in the research, in the IT management of the hospital management, and also to facilitate each other, join hands in bringing whatever work we are doing and taking it to the bigger heights.
So, how many people and delegates are here in Lucknow?
From American University of Barbados, I'm here, and from University of West Indies, Professor Landis. He's a principal and pro vice chancellor. Then Dean, Dr. Kohal, and also Professor Alok Kumar. We three from University of West Indies are here present.
The program is about exchange of the managements and everything. So, what is this program actually?
This program, the delegates from University of West Indies, they have visiting here to see how they can collaborate, and they have looked into certain areas, and they have finalized few areas where they would like to collaborate with Eras Lucknow Medical University. And American University of Barbados is also taking part in this collaboration. And we want to collaborate in research and IT management, in personalized medicine, and many other things that Eras is offering. And also, University of West Indies also very well known in many areas, so we want to collaborate with them to add to the knowledge.
What is the purpose and how this conference and collaboration helps the student of Era Medical College or Indian medical students?
Yeah, actually, all three universities have their own investment in the knowledge, in the research, in many fields. So, y- joining hands with each other is always a good beginning for greater heights, right? So, I'm sure in the long run, all three universities will help each other and take whatever they're doing to a bigger heights.
You have seen the American culture and Indian culture. You are from India and you are actually representing India there. So, what do you actually advise to the medical students and the students, those who are actually, searching future in medical industry? What would you like to suggest?
Very good question, actually. So, medical field is changing. It's dramatically it is changing. AI is taking over. Digital health, digital technology is taking over. So, today's doctors should see which what they have to specialize. What are the things that is going to be futuristic? So, I really advise that students to look into it and also go forward. I'm very impressed with Eras, Lucknow Medical College. They are already facilitating this new technology and new ideas, and they're providing it to students. So they have to look into it and go forward with that.
With camera person Chandan Gupta, this is Junaid Pathan, 9P News Live, Lucknow.